107.3 JAMZ. This is a weekly forum where opinions are voiced about the most talked about issues in the community. The views and opinions expressed on this show are not necessarily those of Summit Media, LLC. Here's your host of Pause for the Cause, Mychal Maguire.
Good morning, Upstate. Mike Maguire, and I'd like to welcome you back to our weekly community show. Now, on the 21st of this month is National Fentanyl Prevention and Awareness Day, and today from Behavioral Health Services, I have Jessica Gibson, who is the Director of Prevention Services, and I have Kim Chastain from Foothills Fentanyl Fight. And welcome, ladies.
Thank you for having us.
Thank you.
So right away, let's just start off with you giving me a little information, Jessica, about your organization and how you and Kim got together.
Sure. So Behavioral Health Services of Pickens County has been in existence for 50 years this year. We've been serving the people of Pickens County since 1973. So we offer services for treatment, prevention, and intervention for a variety of needs. Our most common service is substance use treatment, but we also provide treatment for things like trauma, domestic violence, whether that be a perpetrator or a survivor. We have a group for both. We also do a lot of individual counseling with school children. We see the kids in the schools. And then in the prevention department, we also go out into the schools. We have a group called the Youth Board. We use them for what we call peer education. And they help us reach young people because they're not going to listen to me as an old lady up there saying, hey, don't do drugs. But if their peers get up there and say, hey, don't do drugs, it has a lot more meaning.
How many people is a part of your organization? Because this sounds like a major undertaking.
So currently Behavioral Health Services employs about 50 full-time staff. And then our youth board is made up of 17 high school students from Pickens County, all the high schools.
Okay. And how did you and Kim get together?
So in May of this year, we premiered a documentary that was called Invisible Enemy. And so when we started advertising for that, we were looking for family members who had lost their children or loved ones to fentanyl poisoning. And we connected with several.
So the documentary was about fentanyl?
It was.
Specifically?
Yes, specifically about fentanyl. And we found some moms who had lost, actually all the moms we interviewed had lost their sons, and we had not connected with Kim at that time, but some of the other moms that we interviewed were in touch with Kim and her husband Tony, and they lost their daughter Emily, I believe it's been just a little over a year ago, to fentanyl poisoning. And we do like to say fentanyl poisoning because these kids who lost their lives did not know and did not intend to consume fentanyl. It was something that they got that they thought was something else, and it ended up having fentanyl in it, and that's what ultimately took their life.
I know that the 21st of this month is National Fentanyl Prevention and Awareness Day. And do you guys have things that you're doing on the 21st?
Well, we're not doing anything specifically on the 21st. We'll put some social media messaging out there, but we are we do have some events coming up not too long after that. I'm going to let Kim talk about the fentanyl rally that we're having on August the 27th.
The 27th, yeah.
Yep.
So, yes, on Sunday afternoon, the 27th at 5424 Calhoun Memorial Highway, we'll be having a fentanyl awareness rally, and we've partnered with some other groups besides Foothills. There's a group, Fear, out of Greenville. They lost their son to fentanyl, and that's for fentanyl education awareness resources. I've got the Pickens County Sheriff's Department involved, the Easley Police Department involved. The Phoenix Center is going to be coming and bringing their mobile substance abuse trailer. I think who else?
We'll have Narcan out there available for people to get. If you don't know what Narcan is, it's the opioid overdose reversal medication. So it's really good to have on hand because we're seeing the fentanyl in everything now. It's in the marijuana, it's in the methamphetamine, it's in the pressed pills that people are buying thinking it's a Xanax or a Adderall, and it ends up being made of mostly fentanyl. And so we're encouraging people to really get Narcan, even if you don't feel like you're around somebody who may have a chance of misusing a substance. Because let's say your elderly parent is on pain medication and they accidentally mix up their medication and take too much.
Right.
Narcan can help with that as well. So not only is it saving the person who may be misusing substances, but it's also saving other lives as well. And as long as we're getting that in the hands of people who are misusing substances, they're going to live for another day to hopefully see the opportunity to get treatment and to get into recovery.
Okay. Kim, before you got into the Foothills Fight organization, were you out there and doing a lot of this stuff beforehand?
No, not really. We did a rally in downtown Greenville back in May with the FEAR group. And it just really, our group just kind of formed just here recently. I mean, just within the last few weeks. I just knew there was a lot of parents in Pickens County that had lost children, and there was really nowhere for us to kind of connect and come together and support each other and go out and do these things. So I just reached out to them and said, this is what I want to do.
How often do you guys meet?
We haven't actually met. Our rally, that's kind of our rally that we're doing is kind of our kickoff to our little group that we've started. Okay.
I know you guys also have a candlelight vigil, which is happening August 31st. And I'm sure you have some other events as well.
We do. The candlelight vigil is going to be on what's actually International Overdose Awareness Day. So we just want to bring people together to remember the people that we've lost without that stigma that is sometimes placed on people who die from a drug overdose. Yeah. It's hard, and especially in a community as small as Pickens, it can be a little embarrassing to say that you've lost somebody that way, but we don't see it as a need to be embarrassed by it. Addiction is a disease, right? And it's changing. They've changed their brains to literally need that substance of their choice. So we want to reduce the stigma that is placed on people who have died. We want to give the families a chance to grieve their loved one in a place where people can see that we're celebrating their life without the stigma that they may have faced when they were living. And then we also want to just reduce the stigma of fentanyl in general, because like I said earlier, there's a chance that somebody could have purchased a pill in college, like an Adderall, and they just wanted to study a little bit longer, stay up longer, and it had fentanyl in it, and they're going to die. Or they may be sharing a pill even. Sometimes they'll break the pill in half and only take half of it, and half of it has the most fentanyl in it. And so the person that took one half is going to die, and the other person's going to be perfectly fine, even though they took the same pill. It's a really hard thing to promote to people because they don't want to hear that it's happening, but it's happening a lot. We're losing far too many people. In fact, from 2017 to 2021, the fentanyl death rate increased by 520% in Pickens County.
I was going to say that there was a point in time where you never heard the word fentanyl, and now it seems like, even in Hollywood, every time you hear it, that's what it is. It's
fentanyl. Yep. And I do want to stress also, there's a difference in fentanyl that is prescribed by a doctor and fentanyl that people are getting on the streets. Fentanyl from a doctor is safe to use as long as it's prescribed in, moderation and they know what they're doing.
Prescribed dosages, yes.
Fentanyl on the streets is completely different. It's coming over from China into Mexico and being shipped up into the different states that way. And it's dangerous because they don't care how much they're putting in it or what else they're mixing it with. And it could be a killer instantly.
The way you describe it, I would have never thought it was like that. Yeah. And like I said, maybe 5 years ago, I almost never heard that was, how somebody overdosed. And it just seems like it's just grown by leaps and bounds. So what are some of the other things that you got coming up?
So we've got, I mentioned our youth board. We've got a party coming up on September 16th. We really try to give our youth in Pickens County an opportunity to have a place to hang out and have some fun without there being drugs and alcohol involved. And September is actually Suicide Prevention Awareness Month. So our kids are really passionate about promoting good mental health with their peers so that they don't turn to substances and potentially die from fentanyl or some other form. So we are hosting that Neon Nights Let Your Life Glow On party on September 16th. It's going to be at a new venue in Easley called the Gathered Collective, which is a really cool venue. And it's going to be from 8 p.m. to 9:30 p.m. Just a chance to come out, have a good time, dance. We'll have some mental health messaging for them too. And it's going to be a really fun time for the high school kids.
Do you find that that the kids are more receptive in that area than if they were to come in and it's be a formal classroom environment?
Well, I think with us moving forward with having the Foothills Fentanyl Fight and having these family members who have actually lost people in their lives in Pickens County, that it's going to be really beneficial for us to go either way.
Okay.
Because the kids are going to need to hear this messaging. Emily was 24.
Yes.
And we've got 32, we've got 17, and it's just a wide range of ages that we're losing. So they need to hear this messaging, whether it's from Kim getting up and telling Emily's story or from us just throwing messages out there at this dance party that they need these good coping skills to stay away from substances.
Okay. Kim, is there something that you'd like to say? Because I'm looking at you and it feels like you have something you want to say.
I mean, no, I thought all the way over here about what I wanted to say. I'm not a public speaker. This is way out of my normal realm to go out and do something like this. I just feel like I need to do something in honor of her. I wish and I've talked, all the parents say the same thing I'm fixing to say. I wish I knew then what I knew now.
Right.
That I could have done more for her is why I feel like it's important for us to go out and do this so people will talk about it. Because people don't like to talk about drugs. People need to talk about this drug.
Anything else you'd like to add, Jessica? We're nearing our time.
Sure. I just want to thank the parents who have been brave enough to step forward and tell their kids' stories. It's not easy, like I said, because Pickens County is such a small, tight-knit community. Mm-hmm. It could be shameful and stigmatizing because we hear it a lot, but these parents have been brave, just like Kim and Tony and Angel and Cindy and Jennifer and Tracy and all of these other family members who are brave enough to step forward and say, this happened to me, but I'm not going to let their death be in vain, because we want to educate other people so that nothing like this happens to some other family. We don't have to keep growing our Foothills Fentanyl Fight because fentanyl is not in Pickens County anymore.
Right.
They're going to just say, I told Jessica the other day, the whole point of this rally that we're doing is if one person rides by there that day and gets what they need to save their life, it'll be worth all what we're doing,
right.
Everything. I don't want anybody else to feel how this feels.
I think I'd like to get you guys in here again, maybe next month. I think that maybe we have a recurring time that you come in and speak on some of the things that you have going on. But thank you so much for coming in. Once again, this is our weekly community show. I've been talking to Jessica Gibson, the Director of Prevention Services at Behavioral Health Services, and Kim Chastain from Foothills Fentanyl Fight. Thank you both for coming in.
Thank you for having us.
And enlightening our audience.
Yes, thank you.
Thank you.
Thank you for listening to Pause for the Cause, a public affairs show on 107.3 JAMZ.